Job, great. My name is Julie Bin, and I'm the Communication Specialist for NAMI San Diego. NAMI stands for the National Alliance on Mental Illness. Have you heard of that? Yep. Okay, great. Everybody's very good. We offer free support, education, and advocacy services. We have a number of support groups and classes throughout the county. I've got a lot of brochures for you guys to pick up afterwards. So basically, I also want to talk to you about Stigma. See, my shirt says everybody knows somebody. And this came from just one of our walk teachers. We just had our big annual walk on Saturday. 2,300 people showed up. And it was just great to have that many people having a paper for mental health. This is a great visual stigma buster. So it's true that mental health problems can affect anyone at basically any time. That's why everyone needs to understand how mental illnesses impact individuals, families, and communities for tonight. It's also why we need to learn how we can support our friends who are living with mental illness. And caring friends make a real difference in you've heard tonight. And NAMI has partnered with the Substance Abuse and Mental Health Services Administration to bring What a Difference a Friend Makes campaign to San Diego. And we've got brochures on that as well. Basically, the prevalence of serious mental health conditions in the 18 to 25-year-old group is almost double that of the general population. Yet young people have the lowest rate of health-seeking behaviors. And this group has a high potential to minimize future disability if social acceptance is broadened and they receive the right support and services early on. And oftentimes, that simply starts with a concerned friend. Now, in just a minute, Ellen, her doctor, is going to speak on how friends can make such an impact on the recovery of those who have mental illness. But before she does, I just want to restate some of the stats and facts that we talked about a little bit tonight. A recent survey done by NAMI says that 1 in 3 students reported having experienced prolonged periods of depression. In fact, 15% of all college students have actually been diagnosed with depression. 1 in 4 students reported having suicidal thoughts or feelings. 1 in 7 students reported engaging in abnormally reckless behavior. And 1 in 7 reports having difficulty functioning at school due to mental illness. And half of the students who struggle with depression and anxiety do not seek help in desperately need. Now, according to the survey, students are most likely to turn to friends should they experience a serious mental emotional problem while at school. 62% of students reported that they would turn to a friend. 46% would access a parent. 30% would go to a campus counseling center, and you've heard about CAPS. And I actually didn't go to UCSD, I went to San Diego State, and they had a similar program there that I utilized. I have depression, anxiety, PTSD, and digital disorder, kind of a long list of disorders. But I found them to be very, very helpful. And I was actually able, I actually had the anorexia while I was in college as well. I was able to start a support group with help some teachers there. So I want to just finish up by talking about recovery real quickly. One of the most important things to remember about mental illness is that people can and do recover, just like Lucas was talking about. Basically, you go on to lead happy, productive lives and contribute to society and make the world a better place. Now, people often benefit from medication, rehabilitation, psychotherapy, group therapy, self-help, or a combination of these. One of the most important factors, though, in recovery is the understanding and acceptance of friends. The first steps are to educate yourself about mental illness, which you're doing tonight, which is great, and be supportive of a friend who might have it. The stigma associated with mental illness is one of the biggest barriers to recovery. But if we want to truly be a healthy society, we need to break the stigma and treat mental illness like any other medical condition. It starts with every one of us.